There's something I need to admit to you, and it might go against everything you've been told about staying healthy after 70. A few years ago, a patient sat right where you are now, calm, responsible, doing everything by the book. Regular checkups, routine screenings, following every recommendation. And yet, within months, something went wrong. Not because he ignored his health, but because he trusted it too much. Now here's the uncomfortable truth most people don't talk about. Not every medical checkup is harmless, especially after a certain age. Some can quietly trigger a chain reaction your body isn't as equipped to handle anymore. Today, I'll walk you through 5 specific checkups that, if I personally crossed 70, I would seriously question before agreeing to. It's crucial to understand the potential downsides. You've probably had at least one of these, or you're planning to soon. This information is highly relevant to you. And the last one on this list? That's the one most people never suspect, yet it causes life-altering consequences. So let me ask you something before we go any further. When was the last time you said yes to a test without really asking why? Because understanding that why might just protect your health more than the test itself. It's about informed decisions. As we age, something subtle but powerful begins to change inside the body. It's not just about getting older. It's about how your body responds to stress. Not emotional stress, but physical stress. Every test, every procedure, every intervention, even the routine ones, places a small demand on your system. Your body's capacity to adapt changes. When you're younger, your body absorbs that stress like a sponge. It adapts, recovers quickly. But after 50, and especially after 70, that same system becomes more like thin glass. Still strong, but far less forgiving. Handle with care. Think of your body like a finely tuned instrument. For decades, it's been playing beautifully, a symphony of health. But over time, the strings tighten. The wood becomes more delicate. Even a small adjustment that once helped can now throw the entire system out of balance. That's where many routine medical checkups become a grey area. They are designed to detect problems early, but they can also lead to overdiagnosis, unnecessary anxiety, invasive follow-ups, and in some cases, treatments your body didn't actually need. And here's the key point most people miss. After a certain age, finding something isn't always the same as helping something. Let's start with the first checkup I would think twice about after 70, full-body screening scans. You've probably seen them advertised. Catch everything early. Peace of mind in one scan. It sounds reassuring, almost responsible. And that's exactly why so many people say yes without hesitation. But here's what actually happens behind the scenes. These scans are incredibly sensitive. They pick up everything. Tiny spots, small irregularities, harmless abnormalities that your body has likely lived with for years. Now imagine being told, "We found something." Your heart rate changes, your sleep shifts. Suddenly, you're not just living your life, you're waiting for answers. And often, those answers lead to more scans, more tests, sometimes biopsies, each one carrying its own risk. I once had a patient, we'll call him Mr. Harris, who came in after one of these scans. They found a small nodule, probably nothing. But probably wasn't enough for him. Weeks turned into months of follow-ups. Eventually, a procedure was done, and complications followed. The original finding? Completely harmless. An unnecessary ordeal. Studies have shown that these types of scans can lead to what we call incidental findings in a large percentage of older adults. Things that look suspicious but never would have caused harm, creating more problems than they solve. So what's the smarter approach? Targeted testing. Not blanket scanning. If you have symptoms or a specific risk factor. That's where imaging makes sense. But chasing just-in-case findings after 70 can sometimes create more problems than it solves. And what's even more concerning is what tends to happen after the second checkup on this list. Routine cancer screenings without individual risk assessment. Now this one surprises people, because for years we've been told early detection saves lives, and in many cases, it absolutely does. But age changes that equation. Take something like prostate screening or certain types of colon testing. After 70 or 75, depending on your overall health, the benefits can start to shrink, while the risks increase. Why? Because many cancers at this stage of life grow so slowly that they would never actually impact your lifespan. But once detected, They're hard to ignore, and that's where overtreatment begins. Surgery, radiation, medications, each one placing stress on a body that doesn't recover the same way it used to. I remember a gentleman, very active, sharp, independent, who underwent treatment for a slow-growing cancer found during routine screening. The treatment itself, not the disease, led to complications that affected his quality of life permanently. And that's the part rarely discussed. Research from multiple long-term studies has shown that in older adults, certain screenings can lead to interventions that don't necessarily extend life, but can significantly impact how that life feels. So what should you do instead? Have a conversation, not just a test. Ask your doctor. Based on my health, my history, and my age, will this screening truly benefit me? Because sometimes the most responsible decision is to monitor, not intervene. Now the third one. This is where things start to become more serious. Frequent cardiac stress testing without symptoms. It sounds logical, doesn't it? Check the heart. Stay ahead of problems. But here's the catch. If you're not experiencing symptoms, like chest pain, shortness of breath, or fatigue with exertion, these tests can sometimes lead you down an unnecessary path. Stress tests can produce false positives, meaning they suggest a problem that isn't actually dangerous. But once that door opens, it rarely closes quickly. More imaging, angiograms, sometimes even stents. And while those procedures can be life-saving when truly needed, they also carry risks, especially in older adults. I've seen patients go from feeling completely fine to suddenly navigating complications from procedures they may not have needed in the first place. One study published in a major cardiology journal found that in low-risk individuals, routine stress testing did not significantly reduce heart attack risk, but did increase the likelihood of invasive follow-ups. So what's the smarter move? Focus on symptoms. Focus on lifestyle. Blood pressure, cholesterol, movement, sleep. These are the real daily indicators of heart health. And speaking of things that seem small but can spiral quickly, the fourth checkup might surprise you. Routine bone density scans done too frequently. Now, bone health matters. Absolutely. But repeating these scans too often can create a false sense of urgency. Small changes in bone density, normal changes, can trigger aggressive treatment plans. Medications that may not always be necessary. And some of these medications, while helpful in the right context, can come with side effects like joint pain, digestive issues, even rare fractures when used long-term without proper monitoring. I had a patient who started treatment based on a slight decline seen in a follow-up scan just a year after her previous one. That decline, within normal variation. But the treatment continued for years, and the side effects became her new daily struggle. Guidelines often suggest spacing these scans out more, especially if previous results were stable, because sometimes patience is part of good medicine. Now, the fifth and final checkup. This is the one I would be most cautious about. Pre-operative testing for minor procedures that don't require it. Let me explain. Before surgeries, even small ones, it's common to run a series of tests. Blood work, imaging, heart evaluations. It feels thorough, safe. But for low-risk procedures, many of these tests don't actually change the outcome. What they can do, however, is uncover unrelated findings. And once again, you're pulled into that cycle. More tests, delays, interventions. In older adults, even small disruptions, fasting, stress, hospital visits, can have a bigger impact. Sleep patterns shift. Confusion can occur. Energy drops. There was a patient who came in for a simple procedure. Routine pre-op testing revealed a minor irregularity. That led to further evaluation, which led to a complication. And the original procedure was delayed for months, all from something that didn't need to be tested in the first place. Medical guidelines have increasingly emphasized reducing unnecessary preoperative testing for exactly this reason. So what's the takeaway here? It's not about avoiding healthcare, it's about using it wisely. If you're over 50 or approaching 70, your goal shifts. It's no longer just about finding everything early. It's about protecting your body from unnecessary strain while focusing on what truly supports long-term health. Start with this simple routine. Before agreeing to any test, pause and ask 3 questions. First, what will this test change? Not what it might find, but what action will actually follow. Second, what are the risks of the next step? Because the test is rarely the end of the story. And third, does this align with my current health goals? Longevity is important, but so is independence, comfort, clarity. Small decisions like these create a powerful ripple effect, because here's the truth. You don't stay healthy by doing more. You stay healthy by doing what matters most and avoiding what doesn't. This is where your identity begins to shift. You're not just a patient following instructions. You're an informed protector of your own body, someone who understands that more medicine isn't always better medicine. And that awareness, that strength. If this opened your eyes even a little, I want you to do something simple. Type this in the comments. I choose wisely. Not for me, for you. It's a small commitment, but it changes how you approach every decision moving forward. And if you know someone over 50, someone who trusts every test without question, share this with them. It might help them avoid something they never needed in the first place. Finally, if you want more guidance like this, real, honest, experience-based advice that helps you stay independent, sharp, and in control, make sure you subscribe to Dr. Andrew Collins, to Senior Health. Because your health isn't just about living longer, it's about living better, and you have more control over that than you think.